Following portion of Living Local DMV is sponsored by DC Health Benefit Exchange Authority. Welcome back to Living Local DMV, everyone. August is National Black Business Month. The DC HealthLink joins us in studio to promote the importance of small businesses providing an affordable and quality health coverage plan for their employees. Here to break down how healthy employees can take your business to the next level and find out more resources, let's welcome Luis Vasquez, the Director of Business Development for DC HealthLink. Luis, thank you so much for being here.
Thanks for having me.
Absolutely. So let's get a little introduction going. What is DC HealthLink all about?
DC HealthLink is the online health insurance marketplace where DC residents and small businesses can find quality, affordable coverage. On the small business side, we offer over 150 different plans to meet our members' varying needs and budgets. I'd highlight that for our small businesses, one of the differentiating and most valuable factors of DC HealthLink is that they can offer coverage just like large companies. So we call this plan choice, and what it means essentially is that employers can offer their employees more than one plan. This is a game changer for many small businesses because it allows them to compete for talent with some organizations that are often much larger than their own.
Absolutely. I mean, this is such a great resource. What kind of business, you say small businesses, what kind of businesses can get in on this?
Sure. So the Affordable Care Act, also known as Obamacare, established the state and federal health exchanges. And the law defines eligible small businesses as those with 1 to 50 full-time employees. Now, I know I've been using the term small businesses so far, but it's important for folks to know that DC HealthLink also covers nonprofits.
Wow.
So, Ellen, many of your viewers might be surprised to learn that many of their favorite community organizations, restaurants, retailers actually cover their employees through DC HealthLink. And for years, we've been proud partners with entities such as the the DC Chamber of Commerce, the Restaurant Association of Metropolitan Washington, and the Greater Washington Hispanic Chamber of Commerce. As together, we've worked to help local founders and entrepreneurs really take their businesses to the next level.
Yeah, as you said, it's an awesome resource, and I agree that many people are covered under DC HealthLink, and it's a great resource. So let's talk about, say somebody's watching and they're like, yes, I want to get in on this. What do they need, like, to enroll themselves?
Sure. So to get started, an employer would need some basic information from their team members, mostly details that they likely already have, such as mailing address, dates of birth, social security number. At DC HealthLink, we have an online portal that is intuitive and designed for self-service, but fear not, anyone who could use that extra hand-holding, our team is standing by to help you at each step of the way. I'd also like to take this opportunity to mention that we have a small army of brokers who are licensed and trained to help small businesses at no cost to them. Small business owners are likely already wearing 10 different hats, and administering health benefits isn't something they can add to the list. So lucky for them, they have access to a broker who's essentially an extension of their team and can take on this work without costing them a single cent.
I love the concept of a small army of brokers. I'm here for it. That's excellent. Let's talk about a small business that might not be able to afford or contribute to their employees' premiums. Can you give some thoughts on that?
Sure. So normally we do require employers to contribute at least 50% toward the health premium of their employees. Now, as a quick aside, that contribution is commonly tax deductible. But we are coming up on a special exception that we grant just once a year. So for businesses that begin coverage effective January 1, there's no minimum employer contribution. So if you're a small business owner and you're thinking about offering coverage, but you can't chip in anywhere near that 50% number, this is your opportunity to offer coverage to your team. I would also add that as part of this limited time offer, we also have some flexibilities that we're granting around minimum participation. Normally we require 2/3 of full-time employees to either enroll in coverage or waive it because they have access to other comprehensive health insurance. So that is also something that we are, again, waiving for January groups. I know that January feels like it's a ways away.
But it's not.
It's not. And it's definitely not not too early to start planning for the things that will make your small business stronger in 2027.
Absolutely. And to wrap things up, earlier I mentioned that August is National Black Business Month. And so how is DC HealthLink getting in on that?
Well, we are so proud of our small businesses who are Black owned, and we really appreciate their contributions, not just to the district, but to the nation at large. We have some small businesses that literally fed folks who marched in Washington, right, during the civil rights movement. So this month and every month, we are so proud to serve our Black-owned small businesses here in the district.
Absolutely, and we feature many on Living Local DMV, so we're very, very passionate about them as well. Well, thank you so much for joining me to talk about this super important topic. We have the website for DC HealthLink on the screen right now. That's where people can go for more information?
Exactly, yeah. So connect with us on social media, visit dchealthlink.com. Whether you're a new venture that's just getting off the ground or you've been around for a bit, we are here to answer your questions and make this process easy.
Fantastic. Well, Luis, thank you so much for joining me.
Thanks so much, Ellen.
Absolutely. The preceding portion of Living Local DMV was paid for by DC Health Benefit Exchange Authority.